last but not least, I think we do have a live transcription as well. So at the bottom of your screen, there's also some closed captioning, which is auto-generated by Zoom. For interactions or questions during our session today, please feel free to use the chat function of the Zoom. If you have any questions at any time, or if you feel comfortable and and it's a nice kind of break in the middle, you can also raise your hand and we can allow you to unmute and you can ask the question by voice.
Yeah.
Great. Kenneth, anything you'd like to add before I introduce us?
Sounds good. Yeah, just people know about the language. That's okay, right?
Yes.
Mm-hmm.
Yeah.
And they can switch back and forth.
Okay, perfect. Yes, you can switch back and forth anytime for any portions for the language. So we will be having the simultaneous interpretation throughout our entire webinar today.
Yeah.
All right. So before we begin, I'd like to do a quick land acknowledgement before I introduce myself. So with gratitude and respect, we honor and acknowledge that we're gathering on this sacred land covered by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaty signed with multiple Mississaugas and Chippewa bands. Toronto is located on the Dish with One Spoon territory, a treaty between the Anishinaabe, Mississaugas, and the Haudenosaunee that bounds each other to share the territory and protect the land. Subsequent Indigenous nations and newcomers were invited into this treaty in the spirit of peace, friendship, and respect to share and care for the resources of this land. We are aware of ongoing impact of colonialism, racism, and other forms of discrimination and social injustices that disproportionately impact Indigenous peoples, as well as racialized communities here on Turtle Island. We stand in solidarity to continue to fight against anti-Indigenous, anti-Black, anti-Asian, Islamophobia, and any other forms of racism and social oppressions locally and globally. And now for a quick introduction of Kenneth and myself. This is our second Resilience Perspectives webinar, which is hosted by the Asian Initiatives in Mental Health at the Toronto Western Hospital. At this time, I would like to invite Kenneth to introduce yourself. Kenneth?
Sorry, what were you saying? I was just checking.
Oh, you were checking the translations.
Yes, yeah.
So
interpretations.
The interpretations. I was asking you to come on the mic and introduce yourself.
Oh, okay. I thought you were introducing
accompany
me.
your beautiful photo.
Okay. Or this beautiful face that's live as well.
Exactly.
So yes, good afternoon, everyone, and welcome. We are so happy that you're joining us. My name is Dr. Kenneth Fung, and I'm a psychiatrist and a clinical director of the Asian Initiative in Mental Health. I'm also associate professor with the University of Toronto Department of Psychiatry and acting as the director for global mental health. So it is our pleasure to be hosting this second in a series of 3 webinars to help increase our resilience, especially in the face of this pandemic. I'll just let Dr. Jenny Liu now to introduce herself, and my Chinese name is Feng Polen. Feng Yisang. Thank you.
Thank you, Dr. Fung. So my name is Jenny. I am a adjunct research professor at Western University in the Department of Psychiatry. And just previous to that, I was Dr. Kenneth Fung's postdoctoral fellow at the Toronto Western Hospital in psychiatry. My background is actually in psychology. So I have a PhD in psychology, and I do a lot of research and work with stress and resilience. When the pandemic hit and we had this opportunity to raise some funds out of the Fairchild Radiothon, we put together a grant application to host a series of webinars to really talk about resilience. We hear the word resilience quite a bit during, during the pandemic, especially. We are kind of in year 2+ now. And so we want to really break that down and talk about what is resilience in the different contexts. During our first webinar, which is available on YouTube, and we'll be sharing that link again with all the attendees along with the slides and the recording of this session. During the first webinar, we talked about anti-Asian racism. And at the time, it was very prevalent, and especially with the spike at the beginning of the pandemic. And now, as we are kind of settling into our 2+ years, we want to talk about other areas of resilience, particularly today focusing on family resilience and what that means, what that looks like for everyone. All right, so let's continue on to the next slide. So for today's agenda, the first hour or so, we will be having a panel discussion with both patients as well as care providers to talk about what it feels like and what it looks like to have chronic illness and to be resilient in that context. And then following that, we'll have a short slide presentation on chronic illness and family resilience. And last but not least, we will do a skills practice to really practice some exercises to boost or to foster or increase our resilience. And during this part, we will be doing breakout rooms. And so at this time, if you are able to do so, I would ask that you rename your name with either starting with an M dash for Mandarin, starting with a C dash for Cantonese, and then starting with an E dash for English. So for example, if I were to rename myself right now, I would do that. I would be in English. My Chinese is not very good. Oh, and my Chinese name is Jingwen Liu. So E dash Jenny Liu, and that would indicate that I would like to be in a breakout room for that is speaking English. And then for the C dash, that would be for Cantonese, and M dash would be for Mandarin. And I'll do my best to assign you to those specific rooms so we can have a breakout in our native languages. To rename yourself, you want to hover over the 3 dots next to your video screen, and then press rename, and then you can just rename yourself. If you are having difficulties, feel free to let me know in the chat and I will rename you. Okay. All right, so let's move on.
Well, I need to the work here.
I'm sorry?
Yeah.
All right, so before we begin with our panel discussion, I want to introduce our webinar panelists, starting with Kalina. So Kalina Yim is a nurse practitioner in hepatology, adjunct lecturer, Faculty of Nursing in the department Faculty of Nursing at University of Toronto, an associate fellow of AASLD, the Toronto Centre of Liver Disease, Francis Family Liver Clinic within the University Health Network, Toronto General Hospital. Kalina, let me go ahead and add you to Spotlight. And would you like to add anything else to introduce yourself?
No, this is plenty, Jenny. This is good enough. Thank you.
Great. And then let me just check on the chat. Please read. Okay. So Kalina, I'm going to ask you to do a little bit of a background for us and your work. So I'm just going to advance the slides for you, if that's okay.
Yes, sure. Okay. Well, thank you, Jenny. And thank you very much for having me here today. It's really a pleasure to be involved in this webinar. I think because my specialty is in the liver. in case you wonder what hepatology is, it refers to liver disease. So I've been working as a nurse practitioner and in the field of liver for over 30 years. So today, the chronic illness that I will be talking would be just focusing on liver disease. So just give you a little bit background about liver disease. The most common causes of liver problem, as I listed here, are the top three currently. The first one is fatty liver. In fact, fatty liver is really the most common cause of liver problem globally, including Canada at this point in time. Not quite. Can you go back to the previous slide, Jenny? Yeah. So the top one is fatty liver, followed by viruses, namely hepatitis B and C, and thirdly, about alcohol misuse. So next slide. So this slide, I just want to show you someone have liver disease, how the disease progress over time. So if you look at the picture from left to right, on the very left-hand side is a healthy looking liver. As you can see, it's nice and smooth. And over time, if there's an insult, for example, from virus, from alcohol, or from fat, then the liver will become red and inflamed and swollen, followed by scar tissues. So over time, when these scar tissues continue to grow, then more and more scar tissues, it will become what we call cirrhosis. So once cirrhosis is there, there's also a chance of developing into liver cancer. Now, once you have cirrhosis, can you do a click, Jenny? So once the cirrhosis, not everyone will run into problem, into end stage liver disease, because when you have cirrhosis, when the liver still function, then you're fine. But when the liver function starts to fail, then there are many problems, such as varices, like you heard people go to emergency, throwing up blood. That's most likely because of the liver problem. Liver disease also affects the kidneys, affect how the fluid move out of your body. So people will end up with the fluid accumulate in the belly. Liver also affects the brain, affects how your body fight infections. And of course, liver cancer is the most dreaded outcome of the liver disease. So as you can see here, it is really a spectrum of disease. It's like many other illnesses. There are some commonalities, for example, with problems in the heart or in the lungs, but there are also some uniqueness about liver disease that really just, that we're really worried. For example, liver cancer, because once you have cirrhosis, the risk of liver cancer is 100 times more than people who don't have cirrhosis. So for me to talk about stress, having liver disease, I'm really, really grateful today. I have 3 of my patients who are willing to share their stories here. So I'm going to introduce my 3 patients and their family members, and then I will be asking them about questions. We want to hear from them about how they feel having this chronic illness and how they cope with this, along with their family members. So I'm going to introduce first Larry and Pat. Larry has been my patient for over a decade, or maybe even 2 decades. And I've known Pat, his wife, very well as well, because they have been very enthusiastic in helping us with the hepatitis B peer support group. And then next we have Elna and Les. Yeah. Hi, Elna and Les. I become to know them, and they're under my care for the past year. And Elna, I will leave to Elna to talk about her disease, okay? And then last but not least, I have Mr. Ng. Mr. Ng, I have known Mr. Ng for at least 10 years or not more. And again, I will invite Mr. Ng to talk about his chronic illness and so forth. And his family member joining us is his son, Kevin. And we're really, really grateful that all of you can be here today and share your story. So with that, I'm going to ask the first question, and maybe I'll have Larry to answer that question first, followed by Eleanor, and then Mr. Ng, okay? So the first question I want to ask is, what was it like when you first been diagnosed with your disease? How do you feel and how do you cope with it on your personal level? Larry, do you want to talk about it first?
Hi, I'm Larry. I feel very grateful and thankful to have been under Colina's care since 2004. I was first diagnosed in 1999, and I had a first attack, and the doctors at that time just say, okay, nothing too much we can do to help you, just go home and rest. So I rested 2 weeks, and everything seems okay. And I didn't pay too much attention until 2004. Then I got really seriously ill, and I went to Colina, and I was able to get help from the liver clinic, and they gave me a biopsy, and they said I had liver cirrhosis, stage 4. So they scared the hell out of me. But in the meantime, they gave me medication, and I've enjoyed a good quality of life ever since.
Great. So you mentioned that you're really scared, right? So did you talk about it to anyone, or how? So did it like make any changes in your life, anything like that?
No, at that time, like even now, there's a lot of misconception about liver disease cannot be cured, and then you just die. But I think that I've learned that under proper care and medication, like we don't die from liver disease. And so I like under your care, like I have the blood test and ultrasound on a regular basis, and medication really helped me. So it was difficult in the beginning because not too many people knew about the liver. So, but right now it's changed a lot. Like with a lot of seminars and everything, a lot of information that we can have to look after ourselves.
Great. Thank you. Elna.
Okay, yeah.
Would you like to tell us how you feel when you first diagnosed with your chronic liver disease, and how did you cope with it? Like on your personal level.
Okay, my name is Elna, and I don't know at first. I don't understand until such time that I have this kind of disease. I really don't understand it. I know I heard about these words, but I don't understand. I know there is liver disease. I have this so many kind of diseases, but I don't have this disease that I have now, right now, that I'm facing now. And I feel good when I found you and together with Dr. Cunningham, because you work hand in hand together, then I feel good. I get so mad. I get so frustrated because I don't really know what to do with myself. I don't know if I said to myself, I will be dying, or I don't know. But I need help. I got good help. That is best for me that I could I could say.
Yeah, I can hear that you feel frustrated.
Yes, I get frustrated and get mad for myself, afraid of myself, and so many that I declare it because I don't know. But when I realize it, then I get so frustrated myself.
Mhm, mhm. Okay, so next one we have Mr. Ng. Mr. Ng, can you tell us about how you feel when you first got the diagnosis of your liver problem?
我見咗我家庭醫生啦，我覺得唔妥噃咁家庭醫生咧叫佢去CT scan 啦，去西方醫院 CT scan 啦，咁 check 出嚟話，哦，你有肝病喎，佢話。你有見嘅專科啦，嗰個專科咧係Dr. Hitchcock，佢係非常好嘅醫生，成日講我聽點樣應付啊咁。當堂我有呢件事咧，真係好似失去玩咁，我以為玩完啦咁。1994、1995年已經開始啦。我依家成17、18年嘅咁多位，全靠係嗰啲醫生嗰個醫生又去揾嗰個手術醫生 Dr. Gray， 佢非常好。佢一味講我聽，你有呢件事，你好容易 upset， 即係好嬲嘅，個脾氣好粗暴，你要小心，千祈唔好自殺，千祈唔好做傻嘢，小心食嘢，唔好飲酒，唔好乜。咁咧，佢經過好多手續，我準備去肝病移植手術啦，搞成年幾，一味去驗照心臟咁嗰方面咧就搞咗好耐。咁呢就簽咗話2年，咁你咁可以安排你有咩事可以施手術。咁咧咁咧嗰個醫院咧，佢應承咗之後咧，唔夠2個月咧，哇！3更半夜佢打電話俾我，咁我你要即刻依家嚟我呢個General Hospital手術移植咁我當堂個決定，我依家唔係咁差㗎喎，咁突然間有二假咁2個2月啫，咁我決定話我搭醫院，我話唔移植住啦，我仲去睇內的咁多。睇我個情形點樣先啦？我話呢啲手術我知道唔係好簡單嘅，係好辛苦、好難應付嘅。咁咧，梗係好怕啦，係嘛？見過啲醫生各方面嘅解釋咧，咁咧手術醫生Dr. Gray咧。佢係最小心嘅，最小心。佢講你聽人生過程，我係做doctor，雖然間係啫，我話我哋doctor都係照個情理去醫你嘅呀。我話如果唔得，我驚住一味施手術就好容易瓜嘅喎。咁唔係，咁樣你又唔使驚得咁犀利咁。咁佢就話唔會嘅，我哋有90%幾先做嘅。我見過咁多嘅檢驗， 你已經係合資格，有能力應付緊呢個手續，去冠病如疾，我已經準咗你哋係合格㗎啦，你驗過晒㗎啦咁我話我都係斜下先啦咁佢咧佢介紹我家庭醫生介紹Dr. Hicko啦，俾啲藥我啦，俾啲藥我食啦，初係食嗰啲仲未係正式嘅咩咧，係試藥嚟嘅，唔使錢，就食咗幾個月啦，咁唔得啦，要咩啦，咁Dr. 嗰個 Colina Yim 咧就佢一班人咧係聯絡得好好，對我呢好大嘅幫助。呢幾個人我話咩嘅，好多謝佢哋，我能夠生存喺呢個世界上，能夠呢個病症咧，經過咧16、17年咁樣嘅咩至到依家咯，到依家嘅情形咧就見敗咯。呢排呢幾個月咧，我覺得好敗啦。我知道我個心情，我知道噶啦。我話咁好彩，次次係去揾個醫生同你咁打針入去，我已經打咗6次嘅嗰啲打入去燒嗰個肝個 spot 咧，每一次咧佢照到嗰個 CT scan 咧，個 spot 咧係好似個 quarter 咁大嘅，咁佢每一次燒咧都係好，都幾辛苦噶啦，不過都捱得住咁解啫，係嘛？咁燒一次又一次，一次又一次咁。今次呢，我變咗10幾年啦，個水腫咧，如果唔係個疫情咁樣咧，整我遲咗1年咧，我先做 CT scan 咧，就冇今日咁樣水腫嘅事，我覺得已經遲咗去理佢，俾佢擴張咗不良個反應。咁起嗰陣時咧，佢個水腫咧，佢係好快就令你好麻煩咯。第一個胃口唔好啦，隻腳我知道水腫咧係老人家呢啲好重版嘅事嚟嘅。我見咗我嘅家庭醫生，佢就話：佢話你咁嘅年紀啦，佢話我時常講啦，我話我都要心理準備，隨時準備玩完噶啦。依家超過80咯，仲走得幾遠咧？咁我話冇一次話咁好彩喺醫院次次咁舒服咁走出嚟啦，係嘛？依家過咗80幾，依家嚟到水腫，咁咧我覺得一步一步咁樣見家庭醫生咧，個醫生佢就俾啲藥同我打針咁等減輕個水腫啦，咁都唔得喎，咁有多少好少嘅幫助，但係佢一日咧就可能啦個胃口咧乜嘢都係嘢都唔想食，係嘢就好似飽咁樣，因為嗰個肚咧佢已經咧水咧已經喺 喺個肚嗰度嚟啦。咁咧，我覺得話，咦，我話都唔掂噶喎，咁我啊去入醫院，麥西拿醫院。去麥西拿醫院咧，咁佢啊做嗰個醫我咧，佢話你水腫呢樣嘢咧，哇！佢今日成大半日咁樣 check 我噃，大半日咁樣照過晒 check 過晒驗血驗幾次，先做過晒。佢啊打啲針打成2-3支針，我都唔知道嗰啲叫做乜嘢。不過呢，我覺得佢呢就非常有效喎。咁呢佢又我又睇你嘅水腫點樣啦，咁啊打落我個肚嗰度，咁抽啲出嚟，咁個醫生就話你呢啲水呢係冇害緊你嘅，我話係清嘅，冇咩大事嘅咁。
Okay.
我呢就
吳生啊，Mr. Ng? Mr.
Yeah.
Ng? So thank you very much for sharing the story.
Yeah,
We will
yeah.
come back to you again and
Okay.
ask you a bit more.
Okay.
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 So yeah, so I
Yeah,
just want
okay,
to
yeah.
have
Yeah.
a quick summary of what he just told us. Actually, he was diagnosed with liver cancer many years ago. And when he first got the diagnosis, he was depressed, he was scared and feared, and he was told by the doctor, well, you know, stay calm and like don't try to commit suicide. He thought that he's going to die. But he survived all these years, and over the years he actually had 6 liver cancer, and every time he got like managed very nicely, and so he just tell us how he felt and how his symptoms, his liver, he felt that his liver is getting worse, and his last hospital admission was only like a few months ago, and he just feels that his health has gone downhill from there on. So I think it really, his story sort of tell us how liver disease can progress over time, how it can affect you in many ways, like, you know, mentally and physically and psychologically. So my next question is, maybe I can go back to Larry and Pat, like Patricia. So tell us how you feel when you first learned that Larry has cirrhosis.
My reaction was that I'm so thankful that he got into the clinic that, what is that, Toronto Western at that time. And somebody who knows exactly what kind of treatment he's getting. And once he took the medications, I forgot exactly the name of the drug, and he seems to be 100% better. And I'm really thankful for the chance he got admitted to your program. Much appreciated, and thank you. And from then onwards, his attitude and mental attitude is really turning from negative to positive. So it's really a good sign he's doing well. Thank you.
Great, Patricia. Yeah, that is very positive. What about Les? Les, tell us about how you feel when you first learned about Eleanor's liver problem.
Yeah, I kind of had a feeling of disbelief, but I said to myself, I know she's going to be in good hands to begin with, because we started out going to Dr. Sherman initially, which is some time earlier than like the last 5 years, I think, prior to that, roughly, or it's maybe more than 5 years. And after that, we met you and Dr. Cunningham, and we continued on, and somehow for a while things were not so good, because Elna came in and out of hospital emergencies, and somehow we managed to get things done through you and Dr. Cunningham, that she's back home now, and she's been home for the last, was it a month and a half or so, that she's basically able to get strength in her feet and was able to do things on her own, which was so important. For me, it was difficult in this situation when she couldn't get out of bed, and I had to help her out and use the commode, and she basically, I take her to the hospital every week for various tests downtown, and basically keep on being vigilant with her situation, and trying to go to every appointment possible that she needs. I'm always there for her, and I hope she, I guess, appreciates that too. So I do my best, and other than that, she's basically in good hands. We have PSW coming in today. There was one to help her with bathing, and we also have a physio coming in twice a week, right?
Yeah.
Twice a week. So so that is it's just started. That's why I mentioned twice, because so far I've seen her once, and she came in the second time again. And in any case, so plus we got her the wheelchair, walkers, 2 different walkers. She was in Toronto rehab for a while, and from there on, after rehab, I got her a walker, a light one, and then I got her one with a seat that she could try to go outside, but the weather's not so good. So she's basically staying in as much as, the weather allows. And so she doesn't use the other walker with the seat. And in any case, and now that the weather's changing again, and we're mostly at home now, and I try to take my own walks to keep myself going, because I have an issue with my feet, my right foot especially swollen. So I try to do my routine because my doctor told me to do that. So in any case, I may take an hour or 2 longer, but at least I have to do that. So I hope Elna realizes the fact that I've got to take my time doing this. It's like if I'm away for 2 hours or 2.5 to 3 or something like that, in general, I've got to do what I've got to do. So, then I come back and then everything's okay. Then I get things straightened out if there's any issues. And I told her to call me if there's any problem, which, if I'm outside doing my routine, and to call me if there's any issue, and I could as quickly as I can come back home. And otherwise, we have Kara here, our daughter, who helps out a lot. She's helped us setting up the Zoom as well, and her studies constantly and everything. So between things, things are running. I hope things are running to Elna's satisfaction, right? Is it?
Yes.
Okay.
Okay. Well, thanks for sharing, Les. I'm sure Elna really appreciate your day and night help with her. And honestly, from our perspective, we always also very appreciative of your help to Elna, helping her to get to our clinic on a weekly basis, helping her in everything. And, Les is wonderful. So next, Kevin, we would like to hear about your feeling, how you cope when you know that your father has liver cancer.
Yeah, so the challenge with this one was it was basically over quite a bit of time. He was diagnosed, I think, in '94, and it was about 2000 that I would say it comes in waves. So you get a wave of information, new news, things that you don't understand. So certainly a lot of time to try to understand research process. It was a difficult part. I think there is a certain amount of language barrier there, and also the ability to comprehend, right? So a lot of doctors, they use terms like carcinoma and other terms, and those are terms that someone like my father would not understand. So it took time to process and to manage that.
Okay, great. Okay, so thanks for sharing with us, Kevin. So I'm going to pass the mic to Dr. Fang.
Okay, thank you, Kalina. Great. It's so wonderful to hear your sharing of the personal impact, and both as a person with the illness and also the personal impact as a family member, needing to worry about your spouse or caring for your father and negotiating different things. So for this next piece, and I'm going to open up to anyone who want to comment, is today we also want to focus on the impact of the illness on the whole family, because we know each one has their own pressure, like emotional pressure. And then it also sometimes comes out in kind of a conversation in the family. So we want to see if you can share maybe if there are conversations or that becomes negative, maybe some fighting, some disagreement or tension in the family, some dynamics in the family that is difficult, or some positive, what you found helpful when you find your wife or husband or son or father, like saying thank you, appreciating. We heard that, sometimes saying thank you or really appreciating. So we want to hear the family conversation, both positive and negative. Who would like to share?
Yeah, can I share?
Sure.
Okay, I think Patricia and I, we participated in the group, the hepatitis peer support group, organized by Kalina, and we've been the founding members of that. And then Dr. David Wong was also a strong supporter of that. I think information about the disease is very important, which we were able to get from the many meetings. We meet 6 times a year, and we get a lot of useful information. And with the information, we have the power to understand what is affecting us and how it's affecting us and how it's affecting our fellow patients and the family members. And I've been very fortunate. I call it a virtuous circle, because if I feel sick, then I'm very negative. If I feel healthy with the help of the constant care, the monitoring, and the medication, I feel very positive. So therefore, once I'm positive, when I'm healthy, then I'm happy. And once I'm happy, and then a happy wife is a happy life.
You're happy. Patricia, why? Tell me why. Why did you say that's a lie?
Satisfied, yeah.
What he says,
so
right. Okay.
Of course, the COVID has affected us a lot. We are 74, and we used to travel a lot. We go to Hong Kong twice a year. We go on golf trips 3 times a year. Go and visit our son in Nashville and Chicago, twice a year. And now all that has stopped.
Yeah, so there is definitely, so what I'm hearing is information is helpful. Treatment that works is very helpful. It decreased the stress in the whole family. Everyone is happier when there's information, treatment's working. Whereas the pandemic you just mentioned can be a stress again for everyone. But I just wanted to hear a little bit, because Patricia, did you really mean to disagree with Larry, or are there sometimes fights between the two of you, or you two are always in agreement with everything?
We always fight, but not on this issue, because we have total confidence. Like Larry said, we joined the peer support group, and they are very supportive. And that's where we got all the information, the basic information about liver disease.
Okay, so I'm hearing that you guys fight about everything except liver disease.
everything and anything every day.
Everything except liver disease.
Just
Okay.
like a normal couple.
A
You guys are
normal
normal.
couple. You guys are normal.
I'm
Okay.
saying,
Okay,
really
so-
thankful
So
for
thank
that
you.
couple.
Thank you for
Yeah.
your sharing. Let's also hear from Elna and Les as well. So is it the same like we heard from Patricia and Larry? They fight about everything except for liver disease, thanks to the support group, thanks to the information, thanks to Colina. It prevents them from arguing. But how
That's
about
very
you?
true.
How about you, Elna and Les? Do you guys get along, or do you guys argue over healthcare or treatment or?
Oh, yeah, you are right. Sometimes we argue, sometimes we're happy. We happy, I'm happy. We if I'm not happy, I argue with him, then that's the fight starting. Because
But what do you argue about? What do you argue about?
so many things. Because if you are not feeling so good, there are always things are different. You like it's different. It's completely different. You are not.
How is it different?
You're not happy. You're not. What is that? Everything for him. Sometimes they will say, like this and that. You disagree with it.
Okay.
You don't.
So I'm hearing kind of what Larry is saying, right? If you are not happy, you would disagree more
Yeah.
with less.
If you're not happy, you disagree. Yeah.
Yes.
Usually the wife is the one who is starting the fight, not the man.
Oh, okay. Or do
Yeah.
you mean, I think what you're saying then is when you're sick, then you're not in a good mood.
Yeah.
And then sometimes that gets come across when you are talking with your husband.
That
Right?
is because if you're not sick, you feel everything for you is not so good.
So everything your husband says is wrong when you are not feeling good mood.
Yeah, that's exactly everything is wrong. Yes, you little things he said, you argue
Okay.
with it.
But let me ask you this, Elna, because I think Les asked several times. I hope Elna appreciate what I do for her.
That's correct.
That's correct. Okay, Elna, do you ever express this kind of thank you?
Oh yes.
Oh yes. I don't know. Les is asking us. Maybe not enough.
When I get mad, sometimes I don't say thank you. I just ignore.
Okay. When you get mad, you don't say thank you. But how about when you're not mad? Do you say thank you? Because I'm seeing Les going, yes, I want more thank you. Is that right, Les?
It's correct. You are correct.
Okay. I think Les is wanting me to tell you to say thank you more often when you're not mad.
That's exactly correct. Again, Dr. Funk.
When you're angry, it's okay. But when you're not angry, don't forget to say thank you.
The other way around.
Elna is saying the other way around. Les, you should also be grateful for your beautiful wife, right?
Absolutely. But one thing I would ask her is not to be so strict, because being strict, it confines me into like shackles practically, And this is why, I need to get away for a couple of hours doing and I don't want to be shackled up. And if I'm an hour late or something, there's no reason to blow up again, for her situation.
I think Les is asking permission for a little bit of me time for Les, so he can take a rest sometimes,
Yes.
What do you think, Elna?
Oh yes, yeah. He could go out. He could go out.
Just not too long. Just not too long.
I can see that he would not go out. He could go out. Of course, this is freedom. He could go out.
But with timer, I don't need a timer.
But sometimes I will ask him, be home only such times, you know, this time you just only go out for an hour, or
Yeah.
because sometimes you go out more than an hour. So I
Okay,
need.
so I'm not in a position to give you how much time, but it sounds like that. I think we're talking about different needs, right? You have your need for Les to help you, and then Les also has some needs to sometimes take a walk or something. So it's
Can I
where,
say something as a wife?
yes.
That we worry about where is the husband. That's
Ah,
why we ask the time to come back
okay.
within
Okay.
expectation, because we worry about their safety too. You know what? Is
Okay,
it
thank
Ella?
you. Thank
We
you,
worry
Connie.
about their safety too.
Oh,
That's why
Connie,
we
Yeah,
always
yeah.
ask.
thank you for speaking on behalf of all wives, why they need to keep track of their husbands.
We are not strict, but we want to worry about your safety. That you
That's,
have to think about. We
oh,
want you to be safety. We want you to come back to take care of us.
thank
We
you.
need you. We really love you, and thank you for your caring too, right?
Okay, Connie. So we can reframe, it's not strictness, but it's caring, you see? So Connie's very nicely say that sometimes we say things that sound strict, but really behind it is care. I think.
It's scary,
Yeah,
yeah.
if we don't care, we don't worry about, and then we don't care where
Okay.
you go.
So Leslie, did you hear
That's
that?
not my fault anyway.
When-
but
when-
men
when
don't
she's-
think of that way always.
Okay, when
They
she's
give us a
yelling at you, she's
restriction.
caring. Okay, yelling is caring, okay? That's what Connie's saying.
Well done, Connie. This is true.
Well done, well done. I think we've got
That's what
the,
I argue with my husband always. Where are you
okay,
going? At least you tell me where are you.
okay,
Not
Connie,
worry
thank you.
about where you go, but I'm worried I'll go whether you're safe now.
Wow, I don't know how much money Elna pay you to speak on her behalf, but I think you have a very good point.
Well,
You have
now
a-
we have to strongly say something. Say,
Yes.
we love you, but we really want you to care about yourself too.
Yes, that's great. That's great. And so actually that's the kind of conversation that often happens between parent and children too, right? The strictness, but is really caring. So I also now want to turn to another pair, Wei Ying and Kevin. I wonder if you can comment on your interaction. Do you get frustrated with each other, or is everything very nicely going happy between father and son?
Kevin.
You want to go, Pa? You want to respond first?
你個仔乖唔乖啊？
Hey. Maybe I'll have a few comments there. I mean, he's lived with this thing for quarter of his life, 25 years. He's 80, so certainly a lot of stress on everyone. Just simple things like logistics of getting blood tests and going to hospitals. Language is also a barrier, so we feel compelled to accompany him to critical appointments. I think certainly people like Colina, Dr. Greg at Princess Margaret, we took the time to listen and had a few encouraging words. I think that made a huge difference. Certainly a lot of stress for everybody in the family. It's almost like it's something hanging over your head all the time, right? My father struggled with it, continues to struggle with it. The interesting observation is, if I dare say, my father is traditionally brought up Chinese male. So he's supposed to be the strongest one in the family. He's supposed to be the care provider. He doesn't show much weakness or emotions. And what I've seen is over the past 20 years, sitting in hospitals waiting for appointments and stuff certainly helps. As you can see today, he expresses himself a lot better. He talks about his feelings. He says, "I don't feel good," which is not something he did when we were young, right? So I think he's learned to do that. I think that helps tremendously. Just talking to somebody. So yeah, even though I know Colleen always has a double book schedule, the couple of minutes that she spends just listening to him talk about how he's feeling and how he interprets things makes just a huge, tremendous difference in the world. Same with Dr. Greg. Even though he was, he was liver transplant, but he continued to see us. And we asked him why. And he said something interesting. He said, "Well, it's because you're one of my better, you're a patient who's doing quite well. So I'm happy to see you doing well." And he gave my father words of encouragement. And, that 5-minute appointment made all the difference in the world. My father would keep talking about Dr. Greg said this, don't be upset. Don't be mad. It's not good for your liver. It's not good for your life. So a lot of these kind of little pep talks along the way by healthcare providers, you get the message that they take the time to express that they care. So yeah, so I think that's I think those are my key observations.
Great, thank you.
I don't know if you have anything to add there?
Do you have anything to add, Wai-Ying?
Tell
You
them
can
how
also-
good of a son I am.
You can also say you can also say in English.
Hello?
Yes, we are listening to you.
Hello?
Yeah, we can
Hello.
hear you, Bill.
Oh, we can hear you.
Yeah.
You can speak.
我喺呢度再次多謝各位嘅專科醫生嚟到諮詢我一切。咁咧呢啲肝病咧對我嚟講咧，對個家庭嚟講咧，我個脾氣的確係好差，無可否認。所以 Dr. Gray 咧每一次佢話。你千祈唔好做傻家姐啊！你好容易㗎，我話你噏出呢就真係好差㗎。佢話你得閒咧就出去啊，行街啊咁。咁我一直都呢10幾年咧，每日朝早晚黑咧，都每一次咧行1個鐘頭。行街出去行，食咗早餐就出去行，夜晚出去行，至到依家咧個水腫咧，整我隻腳咧已經係即係年紀問題啦，係嘛？風濕啊咁啊，各方面啊咁啊，行啲行咧個身體咧就冇咁多長力。對於家人嚟講咧，我的確係。我多謝我個仔咁擔心我，我自己覺得好講唔出咁多。多謝咧醫護人員度向我個仔咁細心，每一次咧佢話爸爸咁成日叫我，我係覺得我個仔咧好照顧我，盡佢自己做仔嘅能力。佢講得好理由，我好服佢。每一次都係佢嘅解釋，但係喺個 family 嘅方面咧，我希望咧閣下嗰啲人咧中咗肝病咧，能夠咧家庭人咧知道。 嗰個中病嗰個人嗰個脾氣呢，的確係好差。我自己都佔咗係好多嘢都講都唔中意，因為佢嘅心情問題，所以督到佢話你出嚟行街，做你中意嘅事，去買下嘢，咁呢你就咩啦咁。但係我嗰個太太呢就好唔中意我，好怕，可以講得好怕。佢啊官病啲前進緊我，你又點啊又點啊咁，講好多啲濕碎嘢呢，咁我都會咩嘅，都明白嘅嗰啲啊。但係啲女人方面呢，無可否認啦，長氣夾啊咩呢？呢啲呢係無可避免嘅，呢個係女人嘅個本性咧，大多數咧有嗰啲女人咧有好明白嗰個病人嘅感受，佢自己咧感到我喺佢個腦上邊，每一日都諗住結束嘅個心情，去嚟面對，唯有係聽從嗰班專科醫生啊，各方面啊咁，我好聽話嘅，我好帶得好緊。咁嘅咧，督到佢都話我你守得好緊，都幾好嘢喎咁。嗰啲醫生咧，佢話試個手指公出嚟，你能夠做得到16、17年啦 ，Miss Ling，我話。我係啊，我真係好難得到能夠16、17年繼續落去，依家都係，依家個水腫咧已經係咩啦？已經係好轉咗。即係我想得過咧，呢個水腫咧都係好難避免完全消除嘅。因為我個肝變質，我覺得就希望咧咁樣，希望咧嗰啲醫護人員咧就會喺藥啊方面啊各方面嘅幫助咧，喺還走得幾遠啦咁。我自己心情咧就係咁樣嘅心理。係啦，多謝好多，
即係多謝你嘅分享啊！
多謝
即係
咁關心能夠坐低喺度，大家相通溝通一下咁啊嘛。
係啊，
心情方面啊比較好啲啊咁啊即係家庭方面你哋的確係自己係好差。我無可否認，但係又唔能夠避免。阿Doctor佢每一次見佢，佢都係咁。你好啦，你冇事喎咁，你見唔見冇嘢嘅喎？negative喎，係好乾淨嘅喎，你唔使摸你啊。OK，you keep this way，咁佢話你。佢哋繼續下去啊！
係，咁我真係好多謝你嘅分享啊！好多謝你嘅分享。你真係能夠分享到咧，即係身為病人都即係會經歷過好多嘢嘅嚇。Thank you so much for your sharing that as a patient. As a patient, it's you go through a lot. You go through a lot, and when you go through a lot, you both appreciate your son and your family, and then also sometimes with your own frustrations, right? That you can have a temper, and you're saying you hope your family members can understand that too. I think this is a common theme we've been hearing now, that like Kevin is saying, like the illness can be like a cloud hanging over you. Yet at the same time, the family, the healthcare providers, sometimes some positive words, sometimes some free time, sometimes some words of gratitude. All of this can still, even though it's a negative atmosphere, can really bring up the family. I think that's what today's conversation is really about. So I think at this stage we need to, I think, bring this part of conversation probably to a close. Maybe I'll just hand things over to Jenny. What do you think?
That's great. Thank you, everyone. And I know we're slightly behind schedule, and usually I am quite.
Yeah.
Thank you so much.
Thank you, Mr. Ng.
Yeah.
I'm quite the stickler for.
Yeah.
Sorry. So I guess to kind of wrap it up, it just very quickly, we want to know, because with the pandemic, things have shifted quite a bit, both in terms of accessing the services, as well as managing your condition individually and also as a family. And so because we're a little bit short on time, I'll just maybe ask each family to share just the biggest challenge or the biggest change you experienced during the pandemic. Maybe I can invite Pat and Larry to share first.
Once again, I'm very grateful and thankful. I've been very fortunate to enjoy good health. And this year, 2021, I play golf 5 times a week. I play 120 rounds this year. So I'm very happy.
Great, thank you so much. So it sounds like the pandemic has actually created some free time for you to enjoy life, and it hasn't affected that much. Now, what about Elna and Les? What about you two? How has the pandemic changed or affected or influenced any of your care to date?
So many things, like with having a pandemic in our society now, it's really completely different, because we things that we used to do before, we can't do it now, and that makes a big difference to the people, to the family, to the patients, and to everybody, not only for us sick people, but to everybody who are what is that? It really affected everybody. It affects that. It affects us, like us before, that we're planning to go somewhere, and after the pandemic, we can't go out anymore, and I get sick. So it really puts me out, and the whole family to what is that in our family, because we cannot we can't do things. We stay at home, and I'm sick, and we just don't want to go out because of the pandemic. Life would be different if there's no pandemic.
Yeah, we couldn't get anybody to, like Elna and I guess especially Elna's worried about catching COVID, because if her friends come over for barbecue, or when we wanted to have some extra people around, like her relatives or even mine, we limit that to maybe 1 or 2 once in a while to visit, and like I say, we couldn't do any barbecuing in the backyard anymore.
Right.
So plus going out, like Elna said, we can't really go out, except I do all the shopping basically now, grocery stuff. So again, due to the pandemic, Elna is very reluctant to even step out.
We can postpone the travel, everything. We're supposed to be traveling before the pandemic, but because of that, it was not.
Yeah, we did have plans to travel, out to like say one of those cruises things. We did that before, but now it's completely out of the question.
Yeah, thank you for sharing that. It sounds like as opposed to changes in how you are accessing care, it's more about restricting your lifestyle because of everything that's happening, and
Yes, yes,
being the extra concerns for health and safety because of that added layer of what happens if you might catch COVID. And so because of that, you have to reduce even the things that you would normally enjoy doing.
yes, yes. And even my sisters, only three of us, even my sisters, even my close families cannot come with me, cannot visit with me. I just talk to them on the phone, but not in person, because I'm afraid of these things that is happening around us now.
Mm. And it sounds like also, Alna, and you're sharing that because of some of the things that you would normally be able to do as together, now it seems like some of the activities are also now falling on less for you to take on.
Yes,
So
he is the one doing now, because I'm afraid to go out.
are you putting a timer on him going out too? Great, thank you so much for sharing. And then now, may I ask Kevin and Mr. Ng for you to share what your experience has been during the pandemic? What would be some of the biggest changes or challenges that you might have encountered?
Yeah, so maybe I'll go first. So I see two fairly large impacts. The first is just the logistics of getting blood tests and going to hospitals, getting CT scans. We struggled with that quite a bit. I mean, it's the risk of going to a hospital versus the benefit of getting these tests done. So we at the beginning we were trying to be hopeful that a lot of people were saying this thing is going to go away in 6 months. So we were holding out a bit. But a year later, obviously the risk of that it became high. I think the second part of that is, my father was talking about, going for, he likes shopping, he likes doing things, he likes being active. He likes gathering with family, and those outlets or ways that bring stress relief or happiness were no longer available. So, when you're stuck at home with your partner, like a lot of people during this pandemic, it creates a lot of stress. So that doesn't help. So yeah, I would say those are the two key areas that I've seen the significant impact.
Thank you so much for sharing that. And Mr. Ng, anything you would like to add? It's interesting because we're hearing from three families and their experiences are very different from, Larry and Pat, in terms of finding some moments to be able to actually enjoy enjoy life and finding some moments of quietness to pick up some hobbies and develop some new kind of leisure activities together and enjoy that, to kind of seeing that restricted activity because of fear of contracting COVID and the increase of risk of exposure. And so you have to kind of scale back or change some of your lifestyles and change some of the things that you really enjoy doing, which we're seeing both Alna and Les and Kevin and Mr. Ng, your both of your families experiencing. And then also, Kevin, you mentioned the logistics challenges. So things like scheduling a blood test or scheduling doctor visits. Now there's more kind of challenges or hurdles you have to jump through. You might have to call, book in advance. It's less straightforward compared to previous. And so it's really interesting that we're getting kind of very different experiences and just highlighting that the challenges and the complexities that a pandemic might bring on, that it's not necessarily straightforward or it looks the same for everyone. It really doesn't. So on that note, I would like to kind of thank all the panelists for sharing your experiences with us. I think this has been so incredibly useful in helping us understand what it might feel like or what it might look like to experience chronic illness as a family, especially during a pandemic. Anything you'd like to add, Kenneth, before I go back to our slideshow?
No.
Right. So I am going to share screen momentarily. And resume our presentation. Okay. So Colina, I'll ask you to kind of take it away and help us, better understand what are the specific impact of a chronic liver disease on the family and the patient.
Okay. I don't think I need to really say too much here because we have heard a lot, like from 3 different families and how they feel, both from patient's perspective and the family member's perspective. So I think this slide is basically just to summarize what have been said. So yes, I think liver disease is just one of the chronic illnesses that impact people in so many different ways. So we heard about emotion, right? So there are different feelings. We heard about psychological impact, social impact, and financial, and of course, relationship. So I'll just very quickly flip through my following slides. Next one, Jenny. So in terms of emotion, I think we heard like all 3 patients, like, Elna and Larry and Mr. Ng, how they react to their diagnosis, their shock. And I have so many patients tell me, well, I don't drink, I don't smoke, and I eat well, I exercise. Why do I still got liver cancer? I mean, that is so common question that people ask me, why me? Like, why am I so unlucky? And also there's this fear of the unknown, what's going on, and they feel sad about being diagnosed with a liver problem. And also, like, I think it's more unique to liver disease is because of this guilt feeling and shame. And some people may not know that hepatitis B, in many countries, the way how people get hepatitis B is from the mother, because the mother has hepatitis B and at delivery they pass on to the babies. And so the mother always have this guilt feeling in themselves, and they, in a way, sort of very protective of their children. That's the way how they react to the issue. Next slide. So psychological impact, I think emotion is just part of the psychological impact, right? I mean, we heard about the stress, like this word, like brought up so many times by our speakers before. And I'm not going to talk more about it, about the anxiety. So one of the anxiety, as Kevin talked about, that especially during the COVID, like you have to bring the patients, like bring his father to have CT scan and for blood tests and all that. And so it's many of my patients, they skip all these monitoring because of the COVID, because they're afraid. But at the same time, they also worry. I said, well, what happened if I really have a liver cancer and because I missed the ultrasound? I mean, that is so stressful. And also this loneliness of feeling being alone. And I have one patient, I remember her so clearly because she said that, well, you know what, I thought that I could get support from my friends. So I told my friends about my hepatitis B, and then end up that all my friends left me. So I felt alone. I mean, that happens. So the next one is, Jenny, the next slide, please, is social impact. Again, liver disease is unique in that there are lots of stigma attached to it. Hepatitis B, because patients feel, well, it is infectious. You can pass it on to other people. So you feel isolated and you have this stigma. And also people with liver disease because of alcohol, and they feel, well, alcohol is always have this stigma attached to you, right? You are abusing alcohol, you are a junkie, you're using illegal drugs. This is why you get hepatitis B or C. So that is the stigma. And also I think the public awareness as well. There's not enough people in the community understand about liver disease, and they thought that, well, I hate this when people label hepatitis B as an immigrant's disease, and I have patients tell me that they feel isolated And it's not so happen much in Canada. And I think that I'm so happy to know that is because I think Canada was such a multi-ethnic country. But back in China, I actually have patients tell me that they need, because of hepatitis B, they were isolated. They have to put in a different room, like, when they're at school, and they don't get a promotion like at their work because of hepatitis B. So there were lots of impact from the society point of view. The next one, next slide, please, Jenny. Also financial. So when you have a chronic illness, you need some, and most of the time you need treatment, and treatment can be costly. Is the medication cost, but don't forget about this, what we call non-direct health costs. Like Elna and Les is a good example. Like Les has to drive Elna down to hospital every week to see us because of the problem. So think about all that money, the driving, the gas, the parking costs. I mean, these all add up. Like when you have to do all these monitoring and the healthcare services, like on a weekly basis, all these like really add up and add to your monthly expenses. So next slide, Jenny. Relationship. I don't think I need to say too much about relationship. We have heard like Larry and Pat talk about happy wife, happy life. So and then we heard about Kevin and the relationship with the father. And I'm really happy for Mr. Ng, you open up and tell us about the feelings, about your family. So really, really grateful for this sharing the stories. That's all I have to say.
Thank you, Colina. So, so for this next part, I want to give an example of the challenges of chronic mental illness as well as a psychiatrist, and some of the stress we see. I think that what we see is everything that Colleen has mentioned that we've heard from chronic liver disease, a lot of them also applies to people struggling with chronic mental illness. And for that matter, people with most kinds of chronic illness may have similar struggles. And in the case of mental illness, there's stigma, and people get mentally ill in the first place because there's often a lot of different stress, and that can continue. When you have illness, sometimes you don't feel like talking to people because of the illness. And sometimes if there's stigma, you withdraw from people. It can be an isolating experience. You just heard that about liver disease. Same with mental illness. Same with many illness where a person, when they feel sick, sometimes our instinct is to withdraw from people, even though we need the opposite. And the reason that we might be withdrawing from people is feeling like, oh, I'm not useful anymore, or this struggle for autonomy, that I can have self-control. And of course, we just heard in the case of liver disease, the impact of ups and downs of the illness when you have a chronic disease. Whether it's a heart disease or liver disease or diabetes or chronic mental illness, it can have an up and down course. And so that can be very stressful for yourself and the whole family. And if we can take the medications regularly, we heard with the treatment, and that's especially an area in mental illness where a lot of people don't like to take medication regularly. We just heard the importance of taking regular treatment, whether it's liver or diabetes or mental illness. That regular treatment with the doctors and medications gives you the best chance to work together to prevent relapses. Next. So a lot of the emotions we talk about. So today is also a little bit about emotions, what we go through. If we look at the stages of grief, we know that these are not actual stages, but it describes different clusters of feelings. People may deny, oh, I'm not sick. Or we heard from Mr. Ng quite a bit, like people can get quite angry, right? for many reasons. Why am I sick? Or you just get angry because you're not feeling well. Or bargaining. If I pray more, maybe I will get better. Maybe if I do everything, then the cancer will not come, or bad things will not happen. People might also feel sad or depressed. And then finally, acceptance means it's okay, I'm living with the fact that I'm sick. So even though these are not discrete stages, and people can bounce one back and forth between stage 1 and stage 5, so they're not actual stages, but it tells us how our feelings are complicated. Next. And sometimes when you have two people, husband and wife, father and son, they may be feeling different things. One person may be feeling like, let's not talk about it. But maybe the wife is angry. No, why are you not taking good care of yourself? So the anger might come out. So sometimes when there's conflict, today we had such lovely couples, there's not too much conflict, but conflict can often occur because we are feeling stress already, and we may be feeling different stress and different emotions, and they can collide. So it's learning how to understand, oh, maybe, why am I so angry? Like Mr. Ng says, maybe I can take a step back. Or maybe the opposite. Why is my spouse always so strict about time and get angry at me? And we just heard from Connie, maybe behind the anger, there's caring. So sometimes those emotions are the surface, and we need to dig deeper. Next. So if we just kind of advance the slides. So we just want to give an idea that when we talk about mental well-being, you can see there's this thing going up and down. You can have high mental well-being and you can have low mental well-being. On the right and left side is you can have a lot of symptoms, mental illness or low mental illness. The idea is this: sometimes people have a lot of mental illness, but they can still be quite happy because they can manage their emotions. Sometimes people can have no mental illness, but they still are feeling miserable. And you just heard that sometimes people can be sick, even with illness for many years, but they sometimes find hope, they can find support from doctors, from family, and they can still have many years of happy life, even though there's symptoms. In the opposite, sometimes you find patients with not that many symptoms, but they can still be very, very unhappy. So this is why we talk about resilience and ways to manage our own coping and emotions. Because just because you have a severe illness, whether it's mental illness, physical illness, you still have a chance of finding peace and happiness. Next.
So I'll talk a little bit about resilience then. Our webinar is called Resilience Perspectives. And oftentimes we think of resilience as something that, we can find inside of ourselves. If we just dig a little bit deeper, if we just, eat well, sleep well, if we just control our emotions, then we can make everything better and we can kind of get through any challenges. And oftentimes we think about resilience in the context of an outcome, right? So if we think about having a diagnosis and whether or not we have a happy life, we can kind of think of ourselves and our resilience in those terms. But resilience is not about a destination. It's really the journey to how we manage all along with the ups and downs. And so then what is resilience? It's really about our ability, our capacity to support ourselves in challenges and support ourselves, support our families. And so the best way that we can kind of think about it is thinking about where we draw our resiliency from. So of course, we can kind of start at the very inner layer. A lot of this is depending on our own health, our own health and health-related behaviors. So we talked a lot about, or we heard all the panelists share the ideas about don't get too angry, it's bad on your health, right? That little bit is the stress management, that emotion regulation part. But it's also about eating well. It's about managing your emotions, managing your lifestyles, going to sleep at a decent time, and finding those internal sources that we are typically very much in control of. And we can rely on those things. That's kind of at the root of our resiliency, but that's not the only part of our resiliency. So much of our resilience is also dependent on things that are outside of our control, but that we have to negotiate or exchange with. For example, we have to rely on supportive services outside of us, whether that's our partners, our family members, or the healthcare professionals. Earlier, Mr. Ng shared about all the wonderful healthcare providers. We heard certainly from Alna and Les and from Pat and Larry about their experiences with the healthcare system and also with each other and supporting each other. So some of our resiliency is about accessing support, is about accessing the services, and why during a pandemic, these things can kind of fall to the backside is if we have to jump through all the hurdles. We have to call ahead to book an appointment, go online to schedule an appointment. You can't go with your family members inside to see your regular healthcare provider. Your regular meetings or appointments gets moved to different times. All of these are external hurdles that we have very little control over. And so part of managing our resiliency is also recognizing that sometimes it's not within ourselves. It's about how we engage with the world around us. Pat and Larry shared really interesting insights about how the supportive peer sort of group really helped them. And so in the absence, or when we can't reach certain supports or services, can we draw on others? Can we find other ways to find similar support to help ourselves? So all of those are part of our resiliency as well. And finally, within the center and kind of acting as this connection between the inside of our resilience, the internal resiliency and the external resiliency are really our values, our love for each other, our compassion for each other, that happy life, happy wife, happy life, right? The shared values and the shared pursuits, us finding ways to align or harmonize our needs, finding ways where, whether if one person is at anger and another person's at acceptance, how do we shift those needs and manage and merge them so that we can kind of collectively support our resilience and find areas of common grounds. And of course, it's also about recognizing that at any given time, our needs are very different. We see from the sharing that the pandemic has looked very different for all of the pairs that have shared today, right? Some have found small kind of moments of sweetness. Others have found challenges in their lifestyles. Others have found challenges in access to support. And so it shows that our needs are different at any given time. And so the first part of that need is really about our essential needs. How can we maintain safety and security? Part of our resiliency is responding to that need. Maybe, down the line, you want to be able to thrive, or you want to be able to manage chronic illness, or you want to take some family vacations. But right now in this moment, there might be essential needs related to just keeping safe, right? Especially with something like an Omicron that is a variant that's just kind of blowing up all over. Some of your concerns might right now be focused on just keeping safe, and that's okay, right? It's about prioritizing those needs and recognizing that we have different ones. There's other parts that's also related to social connectedness and inclusion and feeling like we belong. It's about being able to take that vacation, being able to see your family members for a barbecue, being able to, for less, go out and have some alone time. So those are certainly needs that we all have that are so important to our resiliency, right? Maybe not all of our needs right now has to be focusing on keeping safe. Sometimes we also have needs related to, taking some self-care, going out and seeing some friends. And if we attend to those needs, it doesn't take away from the other needs, but it's about recognizing that we have different needs and finding common grounds. And finally, the situational needs or needs that might just come up. These are things that will also drain our resiliency from time to time, right? That we need to respond to. And so being kind of developing skills relating to flexibility, relating to being able to kind of find other support or find other ways of transportation or find other ways to, to care for each other or to connect with family and friends. Those are very important, especially if we're navigating uncertainties, whether that's related to managing a chronic illness or managing a pandemic that is going on for multiple years at a time. So then really, what are you using your resiliency for then? We can think of it like a car that we're driving, right? Maybe if we're just driving to the grocery store across the street, we don't need a lot of gas in our gas tank for the car. And so we just need a little bit of gas, a little bit of resilience to get to that corner store or just to keep safe. Maybe we just need to stock up on some masks. But if we want to continue to take care of ourselves, if we want to be able to adjust to the longer journey of what happens with the pandemic, we do need to fuel up for the long run. That means we need to be able to know that all of these different areas contribute to our resilience and find ways to fuel up and in anticipation for that. And hopefully get to the goal of, living with chronic illness, living with a growing pandemic that might evolve with different mutations or that might drag out for longer periods of time. And it's really about preparing our resiliency, knowing that we have all of those different places where we can get resilience resources from, recognizing that and taking stock of that and fueling up from that. And so again, just to highlight the sources of resilience, I'll kind of go over these slides quickly because I want to make sure we have some skills building time. So the first source from within ourselves, things like sleeping well, managing our emotions, diet, exercise, those are so important. That contributes to our resilience. And second, from learning and living with each other, hearing each other's sharing, understanding your differences, but also your shared values can really help guide you in terms of aligning your values, aligning those differences and finding common ground. And last but not least, we draw resilience a lot from others. And so recognizing that, that you might need others, but also that you might also be someone else's source of resilience at any time. That could be a way to build compassion. That could be a way to navigate conflicts with your family members, with your friends, with your peers. So I'll skip over this. This is just a summary of what happens if we can fuel up from all the different sources. We can really prepare for the long journey ahead. Okay. And then just something that I want to kind of emphasize as well is that we know from everyone's sharing today that our resilience looks very different, just like our journeys with our chronic illnesses might look very different from family to family, from individual to individual. And so sometimes you can't necessarily always just focus on yourself and helping yourself. You have to also focus on your relationship with others and your access to other services and your relationship with your partner. And so then how do we do that? We also need to focus on our strengths. We need to understand that, if we're having a bad day, our relationship with someone else might change. We might be a little bit grumpier with our partner. We might, be a little bit more short-tempered with them, and that might cause some conflict. And that's okay, but it's about recognizing that and creating some awareness of that you're responsible for your resilience, but you might also be others' resiliency as well. And because we know we need our resilience for different things, we need to prioritize areas where we're most needed. So say, for example, if Alna and Les are having a discussion about, well, who's going to go do grocery shopping, and Les is saying, I'm just really tired, I need some time alone. It's about prioritizing that. Sometimes, even though Les's needs might not always trump Alna's, some days it might, and prioritizing those needs because they might shift. And so maybe Les just really needs a self-care day or a few hours to just go for a walk alone to recharge and refuel. And if we continue to monitor our resilience, then we can better prepare for situations that might come up in the future, whether it's a new lockdown guideline or social restrictions or changes in policy or changes in access to services. If we continue to monitor, we can better understand where we're falling short on, where we need more support, and then kind of create areas where we can help ourselves. And how do we do that? Well, Kenneth, I hope you have enough time.
Yeah, so there's only 15 minutes left, so why don't we skip this slide actually?
Okay. Skip it. We'll make the slides available for everyone.
Okay, so there isn't a lot of time left, but I would like to start with this. What do you think how do you think this picture relate to what we're talking about? Today, we're talking about illness, chronic illness, family resilience, family members, stress.
Neon light.
Sorry, can you say that again, Connie?
紅綠燈，
Hong lok dang, okay. It makes you think of traffic light.
一個紅一個綠。
One is red, one is green, like the traffic light. So what's the relevance of this? Why am I showing this?
One you can stop, one you can go.
One is stopping you and one is go. Who is stopping? Who is going? What's going on?
Stopping, making ourselves mad.
Oh, okay. So you see this as a signal to stop being mad or go
Go
being
and let
mad.
it go.
Or let it go. Green means let it go. Okay, this is what it means to you. Okay.
You put a happy face on each of that is different too.
Okay, and you want to put a happy face on the fruits. Any other sharing? Gladys is saying not all apples are the same. Very good. And Mel is saying there are some differences. Okay, one is turning away from the other. Look at the red apple is turning away from the green apple. That's very cute. And same fruit, but different colors, and they taste different. But could be similarity, but there are differences too. Anita says both are delicious. That's wonderful. That's wonderful.
I don't agree. One's more bitter than the other. So one is more appealing, it may be more appealing than the other one.
Right.
Someone else.
It might be appealing to different people. It may be, that's very good. So thank you for the sharing. So this is really a nice reflection of this, because as people say, we can recognize our differences and value our differences. Thank you, Alan. So one is sweet and one is sour, opposites in any situation. Okay, so I see that there are a lot of people that are highlighting how different they are. And then Tika mentioned that there are also some similarities too. Same with Alan. Okay, How are they similar, by the way, if they look so different and they taste so different?
They're
Because
both
people
apples.
say they are both apples. Connie said the same thing as what Kevin said, right? Genetic code, they are the same. Genetically, they're very similar. So that's very nice. So that's what I want to say. I want to highlight that today, that's right, exactly what Nancy is saying, they're from the same family, which is fruits. So today we are talking about families. So you can see different family in the different windows. They're really the same. They all come from the same family. They're both nourishing, but they have different characteristics. For some, we heard red can be, according to Charlie, mature or stop or angry. Or we just heard there are different stages of grief. One can be angry. But green, maybe that person looks different, feels different. So when we look at the surface, it can be very different. This has many significance. Number one, people might have different emotional state. We talk about different stages. Maybe today you're angry, but your spouse is feeling like, why are you so angry? I don't understand. But tomorrow is the opposite. You are the angry one and your spouse is saying, why are you so angry? It's not my fault, right? So we may be at different stages. Number two, we talk about stigma and labeling. And that's the outer surface, right? So sometimes we only see the outer surface. When we look at chronic illness, sometimes people get labeled because all everybody sees in the family or doctors is the red. But if you peel away the red and the green, they start to look a little bit more similar. The thing is, sometimes what's most obvious, which is our emotions, but also our labels. Oh, this is a person with liver disease. This is a person with schizophrenia. This is a person with diabetes. Sometimes we even say that. I am a diabetic. What does that mean? That means my identity. I am diabetes. I am sickness. But we know we're more than just sickness. We are a person. We're a person with sickness. You're not just a walking liver cancer. You're much, much, much more, right? We heard Mr. Wei Ying is also the head of the household. It's like the man of the house, right? Is the father, is the husband, many roles, not just one thing. We cannot and should not treat ourselves and our family as, okay, look at that walking cancer, right? So we need to go beyond skin deep, the apple skin deep, and really discover what's inside. And what is inside underneath the apple skin, right? What is under the apple skin? You start to see layers of white, and some people say juicy and ready to eat. And even then, there might be some differences, a bit of sweet, a bit of sour. And what if you dig even deeper at the core? Very, very deep. What do you find? You find the apple seeds. And to the naked eye, the apple seeds of the red and green looks very, very similar. So inside, if you dig deeper behind the labels, and even deeper, even not looking at how come you're so angry today? Instead of labeling, you're such an angry husband, right? You dig deeper, you find the core of the seed. And the seed is the values, what we hear. Because that has the potential for everything. Because we know that when we see an apple, deep inside the seed, it has the potential for a whole new apple tree, isn't it? So the most powerful thing about the apple may not be the skin, even though it's obvious. It may not even be the pieces you bite into, but it can be the seed that can always blossom into a whole big apple tree, right? So if we dig deep inside, when we listen to the couple sharing, the father and son sharing, yes, there is the illness we have to manage. Yes, there's the surgery, there's the medicine. Yeah, those things are important. But you dig deeper, there's a lot of emotions. Every day is a different day. Lots of emotions. Sometimes you're angry, sometimes he's angry. For Pat and Larry, it's every day, everything except the illness. They're always fighting, we heard. So lots of things to get angry about. But when we dig deeper, and then what we hear, what we see, what is so emotional is the seeds that connect us. And those are the values of love and care for one another as family. It's what makes us human, is the seeds inside us. So I want to use this as a metaphor for us to reflect on, because we heard so many things today. There's the medical piece, which we want to encourage people to see their specialist, to get the treatment. We see the impact of stigma. People don't want to be labeled. Oh, you're the red apple. You are that green apple that is always sour. You're the red apple that always is yelling at people. Too much fire in your liver. There's all this stigma. Yes, we need to take care of that. And we dig deeper, we need to manage the emotions. But what is most helpful when we dig deeper is the seed of love. Before we did the seminar, we were talking with the interpreters, and I said that this is one of the core slides, even though it looks the most simple, the most non-medical. But I want this to be an image that we maybe take away from, is that we all have seeds inside us. When you see a family member, we have to take care of the outside. We have to manage the emotions, but see if we can connect seed to seed, value to value. What's inside us that counts. The deep inside seed, inside which is love. We heard that with the father and son pair. We heard that in the husband and wife pair. We don't often say it. That's the other problem, because it's so deep inside. Look, when we look at the apple, it's like deep inside. You can't even see it. So how often, I ask Elna and Les, how often do you say to each other, I'm so grateful for you. I'm so thankful to you. Maybe not very often. And I asked the interpreters, and they say maybe there are no words to interpret because we don't say what's inside us. We are good at looking at the outside and say, have you eaten your medicine today? Have you seen your doctor today? Have you taken your blood pressure today? Have you had a good meal? Did you go to sleep last night? Did you go to the gym? But when do we go deeper inside the seed and say, well, today I just want to say thank you. Well, today I just want to say I care about you. Even though you have this illness, we're going to walk through this together. So I'm encouraging all of you that sometimes be in touch with what's inside us, the seed. When you interact with the next apple, there's some bad apples in the family, but they're not bad. Look inside the seed. And also action. See if you can communicate that. Put it into words. Something I challenge each of the couples here and all of you, that's your homework. See if you can select one family member who has an illness of any kind. It could be your mom, high blood pressure. It could be your dad with diabetes. You can just say to your mom or dad, instead of saying, don't eat so much sugar, because we love to say that. No, Colina told me you're not supposed to eat that. Stop drinking. We're good at doing that. I don't need to say that because there are lots of doctors already telling you to say it. But I'm challenging you to go home and say something different and saying, you know, I care about you and I know that you have illness, but I just want you to know I'll be there for you and I care about you. Now, I know it's going to be super hard to say those words because those are deep inside us, like the seed. It's like the potential inside us. But the challenge is, see if you can pick one person tonight and just say something deep from your heart and just see what happens. See if it blossoms into a flower or blossom into something different. Okay, so that's the one slide, experiential skills practice and reflection. If there are any questions or comments about you don't understand what I'm saying, you can put it in the chat, or if you disagree, you can put it in the chat. And I'll turn things over to Jenny. And we can also invite questions. Maybe we'll have a minute. If you have any comments or questions, If you agree and disagree with what I just said, you can put it in the chat.
Sounds good. And I am just looking at the chat. I just want to let everyone know that for those of you who signed up on Eventbrite, we will have the slides and the recording shared by email to everyone. In addition, we will circulate the recording on the WeChat group if you enter through the WeChat group as well. So whichever channel that you were able to join us from, we will make sure that you will also be able to get your hands on the slide deck that we used today and a copy of the recording. The recording though will only be in English. Just wanted to throw that out there. See the chart with Apple, this one. Very popular slide. The one before, this one. Oh, this will be shared with you. So it's just a way for us to kind of connect. Maybe we can end on this today, Kenneth? What do you think?
Okay, I will take 1 minute to talk through this slide, but maybe stay for part 3. We're going to go deeper into part 3. Sign up for part 3. We'll go deeper into each one. But if you are curious, I'll just take you through if you follow my hands. Put your hands together. If you put your hands together, this represents when you're angry today, when you have a temper, when you feel sad or hopeless. The first step you can do is diffuse, like just have some space and say, hey, I can see that I'm angry. And what do you do with all this anger? Instead of pushing it away, you open up and say, hey, I accept that right now. I have this anger and fear, uncertainty inside me. That's okay. Let's not struggle against my own emotions. And bring it to the center of this, not in the past, I used to be so healthy, or future, oh my God, I'm going to die. Just stay here. Right now, I'm alive at this moment in time. And then it's the fist and the cup. This is like the story, including my illness today, my cancer. But this, you're the person that contains everything. Your illness, your past history, but you contain everything. So tomorrow, this may change. You're still here. You're still the person. You're not just an illness. And if you cup your hands like this is what you value the most. The seeds inside the apple, what you care about the most. Those are your values, the values of love. And this is committed action, pinky swear. If you know your values, turn into action. We all love our family. We love our children, but we just maybe end up like yelling at them. This is for your own good, but we may not say what is truly in our hearts. And I love you too, right? So this is committed action, means you have to do it bravely to say something that sometimes we're afraid to or not used to saying. And that can include words of caring. And in part 3, make sure your Sarafas seminars will go deeper and deeper into this.
Sounds great. And then that takes us to overtime now. So just want to end by acknowledging that we are the Asian Initiative and Mental Health AIM Clinic out of Toronto Western Hospital at UHN. And then we already finished closing thoughts, and just want to really acknowledge and thank our live interpreters, Reverend Dr. Harding Ng, Renee Xu, Leah Xing, and then of course also Virginia Pat for providing our live interpretation services for everyone. It's not an easy task. It definitely takes a gift, so we really appreciate it. And thank you, Colina, for coming to our webinar as well. And for all the panelists, you and your family members sharing your stories have made this so amazing. So thank you so much. All right. So everyone, thank you for attending. I'm just going to stop the recording now.